Hi, welcome to another episode of Hot Takes. Wes Streeting, the genius embryo that he is, thought, I know, he says, we've got all this huge backlog in the NHS. I know a way of getting rid of it. We'll throw all the people waiting for too long into private hospitals. That'll clear it up, won't it? Lovely. It'll make the list shorter, and those hospitals can do those. Obviously, we'll pay for the operations, but it's the doctors and nurses there rather than overflowing NHS hospitals. Super idea, except for one thing. He didn't really talk to the private hospitals very well. He hasn't arranged for contracts. He hasn't worked out charges, etc. And so their plan to cut the waiting list by sending patients to private hospitals is now going to not happen because the private hospitals are refusing to take them. They say, we are not the dumping ground for the NHS. If you want to book in and pay for it, fine. But you pay our prices. You pay the normal prices that you pay for, private healthcare. And the government's like, but we can't afford that. And the private healthcare operators are going, yeah, it's a bummer, isn't it? Not our problem. And so this row is erupted because Labour want to cap the amount that they're paying to the private health people. But they're saying, well, no, we're not a charity. We are a business. We have to make money, and everything we do costs. A doctor costs, a nurse costs, the medication costs, the ward costs, the maintenance costs, the paperwork costs, the admin, the maintenance, the cleaning. Everything costs. And they're saying, then what you are offering to pay us per day, per patient, does not cover that cost. We're not doing it at a loss. Now, the private healthcare people have said, we're prepared to do it for a reduced rate, but this is the rate. And the NHS are saying, or the Wes Streeting is saying, oh no, that's still too high. Okay, that's fine. It's your call. And then they put the phone down and Wes Streeting's going, but I'm the minister, you should do what I say. And they're saying, he's talking to himself because I'm not listening. Wes Streeting really hasn't got a clue how much things cost, and he never will. He's never done a day's work. He doesn't understand that nothing is free in this life. He thinks slink it off. He's sort of merging private healthcare and the NHS and thinking that they're one and the same, and they are not. So the plans were unveiled back in January, and he said, oh, we'll work out, this is how much it costs. Because they've looked at the NHS costs and said, right, we'll pay that. We'll probably have to pay a premium, he said, and it'll be an extra 10. So we'll offer 10% over just to clear the backlog. And it isn't even close. NHS England's proposal fell far short than the real costs because a lot of these companies, well, for example, they don't have the scale. They don't have the purchasing scale the NHS has. So NHS get things cheaper than the private. But anyway, this price cap per patient was always going to fail. Wes Streeting should have known that. If he's surrounded by these civil servants, they should have told him. But of course, they're not going to tell him because their job is not to tell the minister anything. Their job is to advise the minister when he comes up with a bright idea. Now, what he should do is come up with a bright idea and then said to the, is that going to be enough? And then they would advise him. But they're not going to come forward and tell him. But on the other hand, when you put someone in charge who hasn't got a clue, what do you expect? So all these promised reductions in waiting lists ain't never going to happen because the embryo hasn't got a clue what he's doing and doesn't understand how much things cost because he's never worked for it. He's never run a business. He doesn't know. You ask anyone who runs a business, they know the cost of everything. Not Wes. Thanks very much. Take care. Bye.